Yes,
Charles.
we're brother.
We're live,
Yep.
Charles. Yeah.
Well, I tell you what, I made a boo boo this morning on my video. I told
Why?
everybody today was Saturday.
Today is Saturday.
Huh? No,
Today's
it's not.
Saturday.
It's Sunday. No, we're only
Today?
kidding. It's Aloha Friday. It's Aloha Friday. Your favorite day of the week, Friday. And we'd like to say aloha to all of you. Welcome to Facebook Live with Mel and Charlie Iona, Mel Raposo, and wow, the end of a week, and we're looking to a great weekend, and hopefully everything will go good. What do you think, Mel?
Well, it's I'm trying to figure out. Yeah, we're just checking the final adjustments of this thing. Anyway, busy day today. It was just a long day, long day, and
Yep.
tonight we have Dr. Janet Berreman, the Kauai, the state or the Kauai District Health Officer for the state of Hawaii. That's right here on Kauai. And it couldn't have come at a better time. Um, I'm wondering why I cannot hold on here. But anyway, we've been talking about COVID now for going on 3 months, and we had scheduled Dr. Berman. And my plan tonight was to talk to her about her thoughts and basically try to get her some predictions out of her about this before today. What will happen. We've been talking about the spike or a spike that was almost inevitable. In fact, Dr. O'Carroll said it was inevitable, and lo and behold, today 15 today on Oahu. So her coming on the show couldn't come at a better time. So I'm excited. I'm excited that she's on tonight so she can go over what the Department of Health thinks about it. I did see the press conference today, the governor's press conference, and it doesn't seem like they're taking it too serious. It's a spike. It's 10 in one household in
It's
Waipahu.
expected. Yeah.
Yeah, not really concerned. My concern is that this is just the first part of the spike. That in fact we're still going through Memorial Day, and we're going through graduation parties, and yet we still haven't even touched on the thousands and thousands of people that were out and about on the protest. So I'm real curious to see what she's gonna say. I don't expect anything different from her than we got from the director of health or the director of the Department of Health, Bruce Anderson today. But interestingly, we'll get to pick her brain at least for an hour. We'll get to pick her brain. So
Well, what my concern is, and if we look at this very methodically and not get too ahead of ourselves, but one thing that I think is troublesome is the fact that if our numbers were so low, right, leading up to this week when this spike occurred, we were based on contact tracing. We should have known where all the infections were, okay? Because we had to have known it. But these numbers now are popping up here and there as if it's like a duh. We don't know where it came from. I mean, that's the part that's baffling me. If contact tracing is what it is, everyone who came in contact got quarantined and they got cleared, right? So that means that infection rate and that spread should have ceased. It should have been cut off. But for somehow during the Memorial Day weekend, it came from somewhere. So only two things could have been possible: was misdiagnosed on the first go around, right? Or it came in, but whoever brought it in, because that's the only other way it can come in, whoever brought it in was not adhering to the quarantine and it slipped through the loop and went and did its thing. So if that's the case, then what this spike today tells me is that it's beyond a practice run. It's actually showing us what our vulnerabilities are. And that if it should decide to take off, the question gonna be, if we get one spike of 100, out of that 100, who will be hospitalized? Like today, you told me 15, one hospitalized, right?
That's what the report said.
Yeah, the person shouldn't be hospitalized. You know, if they're gonna take him that easy. Now the thing is, I hope and pray that he'll outrun this thing. But as you can see, the younger guys took them 7 weeks to outrun this stuff.
Yeah, the age isn't as compared to the early days where everyone was talking about, only the old people were really in danger, but that's not the case. We know that. We know that now. So we're gonna find out tonight. One of the things they said that one of the people tested positive earlier. So is this their second time? The other question that one of the reporters asked was that when the first person got tested, when the first person was tested positive, when at first, he calls it the index, were the other people isolated? These were 14 people living in a 2-bedroom house where, social distancing is not possible. So do they have a facility for these types of families where if you have one member that's positive, what do you do with the rest of them? Do you just let them try to be isolated? So a lot of questions tonight, and she's knocking at the door. So we are going to bring her in. Boom. Smile, Charlie. Smile. Smile. Smile, Charlie. Okay, there we go. Hi, Dr. Berreman. How are you?
Good evening. How are you? I'm good.
Oh,
Good.
awesome. Thank you for joining us tonight, everybody. This is Dr. Janet Berreman, the Kauai District Health Officer for the state of Hawaii, and we're so happy to have you on today. And even I was just talking earlier before you came on that the timing couldn't have been better with the events of today. So thank you so much for joining us.
Thank you so much for inviting me. It's an honor and a pleasure to be here. I appreciate it.
And
Well,
I'm
before-
Mel, and that's Charlie up there. If you see
Before we
Charlie.
go on, before we go on, everyone who's watching tonight, please share this again one more time. Please share this. And just for your knowledge, Dr. Berreman, we also have viewers from all parts of the U.S. joining us.
Wow.
So this is not only Kauai, it's all over, which is good.
Okay. Yeah, I actually listened to the replay of your show with Dr. Capono from a week or so ago, so I got a little sense from that.
Good.
Yeah, we've been blessed with a lot of amazing guests on the show, people from the front lines, and so happy that you could make it. And we're just gonna start. Maybe you can tell us a little bit about yourself. Someone told me that this is your second pandemic that you've been working through. Is that true?
Right. Well, that is true. Actually, I was the health officer, a similar job for the city of Berkeley in 2009 when the H1N1 flu pandemic came through. And I've been reading a little bit about comparing that pandemic with this one. And that one was a flu, so it wasn't a coronavirus. It was a little bit different. It was easier for us to make a vaccine, and we knew a little bit more about it. But it also turned out not to be as serious a disease as coronavirus. So we didn't do a lot of the things that we had thought we might do, which we have done with COVID in terms of closing schools and, stopping travel and all that kind of thing. But the flu pandemic of 2009, the H1N1 flu, actually, it looks like it infected a quarter of the world's population in the first year that it was around. So that's a phenomenal number of people to be infected, many, many more than we've seen with coronavirus. And the main reason we haven't seen that kind of spread with the coronavirus is because it is so much more serious a disease that there's been much greater worldwide response to try to control it. So, but yes, that's true. It's actually true of anybody who was in public health in 2009 was around for that pandemic. So.
In general, Doc, and based on what you just said, in general, the COVID is not the same as the flu. I know we often hear people talking about, the flu is worse. The flu has a, mortality rate is higher, but this is a different animal. This is a different disease than the flu, correct?
Yes, it's a different category of virus, and we're learning every day, every week, every month more about how this particular coronavirus affects people, because it is new as a human infection. But shall I
Have you
back up
seen
a little
anything?
bit and tell you a
I'm
little
sorry?
bit about me? Because that you
Yes,
had
please.
first asked kind of about my history. So I'm originally from California, from the Berkeley Bay Area, although not right in the heart of Berkeley originally. And I'm a pediatrician. I went to college at Pomona College in California. I heard Dr. Capono say that he studied anthropology, which I thought was interesting because my dad was an anthropologist and I lived a lot of places in the world as a result of that. But I did my medical training at the University of California in San Francisco. And when I finished my pediatric training there, well, while I was in medical school, I spent a year in India, and I was working with Hansen's disease patients, particularly with children with Hansen's disease, looking at kind of the social impact of that. And then when I finished my pediatric training, the first job I got was in American Samoa, working as a pediatrician. And I was there for 4 years at the LBJ Tropical Medical Center. And actually our first daughter was born there. And from there, we moved to Oahu, where I was very fortunate to get a job working at the Waianae Coast Comprehensive Health Center. And I was I think the first pediatrician that they hired there. And by the time I left, they had about a dozen pediatricians. So it turned out that that was a need that was recognized. And I was there for almost 12 years. Doing all primary care pediatrics and teaching medical students and being at Kapiolani Hospital and seeing kids in the clinic, all of that. And then my husband's work took us back to California. And that was when I studied public health and when I got the job as the health officer for the city of Berkeley. So I spent about 10 years doing that. And we realized that it had been a mistake for us to go back to the mainland, that we really, our heart and home was here in Hawaii. So I began looking for work here. And Dr. Ball, whom I had had passing acquaintance with, happened to be retiring at that time. And the job on Kauai opened up. And it has really been a perfect melding for me of my history and experience in doing primary care pediatrics in the islands, and then also really learning a lot about local public health. And I feel incredibly fortunate to be here and to be able to spend this later part of my career doing what I absolutely love in the place I love. So I've told many people, and it's true even during the pandemic, I can't imagine a better job. This is the best job I've had in my life, and I feel incredibly fortunate to be here. So that's a little about me.
And we're fortunate to have you, Doc. The mayor speaks very highly of you. He appreciates you and relies a lot on you. So thank you, and welcome back home to Hawaii. It's cool.
Thank you,
And
thank you. I've been back here about 3.5 years now. I started this job in January of 2017, and
it's been a while.
We moved to Hawaii first just about a month before Iniki. So I think that knowing that Iniki was the other bookend, I think we were destined to come to Kauai eventually.
All right, all right. Well, again, unscripted show. We take a lot of questions from the viewers, but let's just start off with today's events, the spike. You know, I had planned to ask you more about what you thought was going to happen as far as numbers were concerned, as it relates to the reopening of the state. But since we had that spike, I did watch the governor's press conference today and heard Dr. Anderson as well as the others. So maybe you can give us an overview about what happened today and what you know about this so-called spike today.
Well, one thing I've learned about COVID-19 in the last 3 or 4 months is that any attempt to project the future is pretty much destined to fail. And it's been humbling because I've realized that I don't have a crystal ball. And the things that I think I know don't turn out necessarily to be right. So I've given lots of presentations and lots of talks about COVID-19 since the beginning of the year. And I must say that in every one of those, I've said one or more things that has turned out to be completely wrong. So I want to, say what I'm going to say with full humility and recognizing that this is a new thing and that we don't know what we're going to see. But we are learning more, as I said, and we've been fortunate in Hawaii that we really acted early and definitively, and have been able to flatten the curve, as they say. And so we saw our rate of cases go up and then come way down. And statewide, our numbers had been very low for a couple of weeks. And then last week, we began to see an increase. Instead of sort of 0 to 3 cases a day, we started to see 6, 7, 8, 9 cases a day. And that was about a week after the Memorial Day weekend, which was also when we had high school graduations. So we know that there had been more mixing in our communities than there had been before. So we weren't too surprised by that increase statewide, but not being surprised doesn't mean that it's not reason for concern, right? Because we would rather keep our numbers really low and not have people be sick. The increase to 15 today was much the largest number that we've seen for quite some time. I didn't look back to when we last saw that big a number in a day. And so when I think about how worried we should be about that, I look at the pattern of where are those cases, and so what we can say about that is that we know that all of those cases are on Oahu, and I want to get back to that and talk about that in a minute because it's really important. But also that of those 15, 10 of them were all related to one household cluster. So although it's a big number, it's a number and an outbreak that we can kind of put our hands around. We know who those people are. We know where they were exposed and how they got sick. And we know what needs to happen in terms of isolating and quarantining them to keep it from spreading more broadly in the community. So although it's a big number, 10 of those 15 are in this one known cluster that we kind of already have a handle on. Even though we wish that those 10 people hadn't gotten sick, we knew that they were all closely exposed. So I would be much more concerned about that number if all of those 15 had been sporadic individual cases all around Oahu or all around the state, and we couldn't really say that we knew how or where they got sick, because that would tell us that the disease is spreading in ways that we don't really have a handle on and that we don't understand. So it's concerning, but I think it's not alarming because of this, of the context for it.
Well, let me ask you a question, Doc, if I may. When this thing first started out, we like you said, the numbers weren't, the spikes weren't like what we're seeing in the last couple of days. But yet decisions were made, and I'm speaking statewide now, decisions were made to shut down. And, we've always asked the question, of Lieutenant Governor, what is the threshold for the shutdown? Because it seems on a layperson, if we were to just look at this head on, we would get confused thinking, gee, in the past, we had less, and yet we shut down. Now we got more and we're opening up. Yeah. So people are having a hard time kind of like rationalizing where's the mindset coming from. I guess that's the question, and I don't know if you can answer that.
Well, I mean, the question of what is the threshold is a very hard question to answer, because just like what I just said about those 15 cases, 15 is a number, but what we do about that number looks different depending on what we know about that number and on the details of it. But if we go back to the beginning of the pandemic for Hawaii, which was in March, there were already a couple, 2 to 3 months of experience with this pandemic worldwide. And we knew that in many places in the world, it had gotten rapidly out of control and had rapidly overwhelmed the healthcare system. And there were many, many deaths. And we didn't know a lot about what it was going to look like in our community. And so we made the decision as a state, and I know that we made the decision here on Kauai as a county with the mayor that, whoa, this is something that we don't yet know a whole lot about. Looks like it can be really scary and bad. We want to keep it away. We want to protect our communities, and we're willing to take pretty drastic measures to do that until we know more about it and understand what we should do. So sort of like, you know, we're going to throw everything we've got at this. We're going to do everything we can to protect ourselves, recognizing that there are costs to doing that, economic costs most particularly, but social and psychological costs as well. And so early on, we wanted to really protect ourselves. We weren't sure how to do that in a targeted way, but we knew that there were big things that we could do to prevent the disease from coming in. And the other thing that everybody's very aware of is that early on, we didn't have a lot of testing capacity. So it was hard for us to learn or to know how the disease was spreading in our community, how much of it was here, how afraid we needed to be. So now that that was middle of March, as Dr. Capono said, March 13th is Friday the 13th is forever embedded in my brain too, because those were our first cases on Kauai. We know a lot more now in the middle of June than we knew in the middle of March. And our capacity in many, many ways is different than it was then. So for one thing, we have tested a lot more people, and we can test a lot more people. And we've been able to watch the disease over those 3 months in our state and understand a little bit more about where it's being transmitted, how we're isolating and quarantining people. We just have better capacity to do all of the things that we want to do to control it. So now we can say, well, 15 cases in a day, that's more than we've seen for a long time. We know that 10 of those are in this one group, so we're a little bit less worried about that. We're still worried about these 5, but 5, unrelated cases in a day is more on the order of what we've been seeing in the last couple of weeks. We have the capacity to do the contact tracing and the isolation and quarantine and the follow-up of that. So with our systems being better in place and understanding more what the pattern looks like in our state, we don't need to respond to this in the same way that we did in the beginning. Does that make sense?
Yeah.
Okay.
And thanks for that, Doc. I mean, I think that
Sure.
People can understand that it's,
Okay.
you almost count the 10 as one almost, one cluster.
Kind of.
One
I mean, like I say, it's still 10 people who are sick.
Right.
We don't know how sick those people are going to get, how they're going to recover, all of that. So we wish that we'd been able to prevent that. But in terms of risk to the rest of our community, it's different.
I know today they I guess they call the first person tested or diagnosed or the test positive as an index.
Right.
And so in this case, the index person, the first person infects 9 others in the same household.
Mm-hmm.
What didn't come out in today's meeting or press conference, or if it did, I missed it, was I'm assuming that the index, the first person was community spread and not, or do we even know if he or she in fact contracted the virus from another local resident or from a visitor?
So the Department of Health does classify each case as being either a traveler or travel related or community spread. And the Department of Health has on the website, there's a graph that comes up that's updated every day that's all in red and blue. I don't know if you guys have seen it. It's a bar chart. And all of the red on there is community acquired, and all of the lighter dark blue is related to travel. And if you look at that graph, in the beginning, in the early stages back in March, most of it was blue, but now for the last month or more, it's been virtually all red. There are a couple of little blue spots. So what we're getting now is almost all community spread, community acquired. There are some of the little squares are light gray, and that means that they're still being investigated. We're still talking to the people and figuring it out. But what we're seeing now is community spread. And that reflects that there hasn't been as much travel since we put the quarantines in place, and also that the quarantines are effective in containing the disease.
So we
And
got
hang on real quick. I just want to get this in real quick before I forget. The contact tracing, I know we talked about contact tracing and they're ramping up the contact tracing, but right now you have 15 individuals. Do we have the adequate number of contact tracers? I know that they're put out a training and there's a lot of people that are in process of getting trained.
Right.
Are we adequately staffed right now with these contact tracers that we can get, understanding that there'll probably be more cases in the next few weeks? Do you believe we have enough people in place ready to go to effectively and quickly contact trace so we can stop the spread of this virus from these infected people?
So I'd like to answer that two ways, one for the state and one for Kauai. So statewide, we definitely have enough contact tracers to manage 15 new cases in a day. So that does not tax us. If we had 15 or 20 cases every day for a week, we would be getting closer to, to our maximum, but we would be able to handle that. The reason I want to talk about Kauai is because I want to tell you a little story about what we've done about contact tracing on Kauai. So you'll remember that our last new case on Kauai was from early April. So I looked at the calendar. We've now gone 9 weeks without a case on Kauai. And I was not willing to sort of breathe a sigh of relief until we got to 4 weeks, which is 2 what are called incubation periods without a case. But when we got to that point at the beginning of May, then I really felt like I could take a step back and take a breath and say, what do we need to have in place on Kauai for when we open, for when tourism comes back, for when the economy opens up, for us really to be able to manage this? And one of the things that I really wanted was enough contact tracers. And the Department of Health has about 120 people working on the island of Kauai, if we include our mental health, behavioral health people, as well as the core district health office folks. And so I put out a call to my staff and I said, I want as many people as possible to be trained as contact tracers. And this was before the UH program was set up, but there's an online program by a state health officials organization where you can take a contact tracing training online. It's not as detailed as the UH one, but it's a good basic framework. And then we're following that up with training done by my public health nurse and my epidemiologist to really teach people about the Department of Health in Kauai and how this works. So we have so far trained over 60 Department of Health employees here on Kauai in contact tracing. And the national recommendations are that we should have 30 contact tracers for a population of 100,000. So you know that our population is less than 100,000, but with if we're back up to full tourism, there are about that many people on the island every day. So we're set to have double the recommended number of contact tracers. And that's just within our Department of Health employees. That's not the Medical Reserve Corps volunteers who are also being trained. So I feel, I never like to say that we've got this, but I feel really like we're in a very strong place here on Kauai for contact tracer needs. That doesn't mean I want to invite in a whole lot of disease, but I think we can all feel pretty confident that we have a good base of folks. Now, these newly trained folks aren't going to be experts, but I have about half a dozen people who are experienced and are taking the University of Hawaii training, so they can each lead a team with a group of these less experienced people and divvy up the work, give the hardest work to the most experienced people and the easier parts to the other folks. So, and I also just want to say I'm incredibly grateful to all of my staff for stepping up. I really did not expect that robust a response, and I think it reflects how committed folks in the Department of Health are to really doing what we can do to protect our community, because we live here too. We want to be safe too.
Thank you.
what is, if you can explain the difficulties? You said that you have some that's very experienced. What goes behind the contact tracing? What sets them apart from the others? And I'm sure the others will get to that level. But right now, the ones that you have with experience, can you tell me, like, the job description? What does it entail to get a better understanding of it?
Sure. So contact tracing actually starts with what we call case investigation. And that means if you were sick and got tested and your doctor called you and told you that you had COVID-19, we hope that your doctor would also tell you you should expect a call from the health department. And then you get a call from the health department. So you're sick. You're probably scared or worried about having this new weird disease. You might be concerned about who else you may have given it to and what's going to happen to you and are you going to need to go in the hospital. And some stranger from the health department calls you up and starts asking you a whole lot of questions. And what that interviewer has to do initially is just introduce themselves in such a way that you're even willing to stay on the phone with us, right? And talk to us about things. And that person's job is to interview you first to make sure that you're okay and that you're getting your needs met, that you know how to see the doctor if you need to, that you have, food and all of the things that you need in what would then be in isolation. And then that person is going to ask you a lot of questions about where you've been in the last week or two. And they're trying to find out two things. They're trying to find out how you might have gotten sick. So that gets to your question earlier about, is this travel related or acquired in the community? And the other thing that they're trying to find out is who else you might have accidentally exposed to the disease. So who you spent a lot of time in close contact with in the period in which you were infectious. So they need to know when you first started feeling sick and where you've been and how much time you spent with people. So the main thing that's involved in the job description, besides understanding what pieces of information you need to get, are just kind of the people skills and the interviewing skills of being able to talk to somebody for a long time, ask them fairly personal questions, establish a trusting relationship, and understand how all those pieces of information connect to each other to help us do what we need to do in order to control the disease. So that initial contact investigation interview, that's the one that really requires the highest level of skill. The next piece, which is what we in health department would call contact tracing, but it's all part of the same thing, is so when I've done that initial interview with you, you might tell me, well, I ate lunch with these three people at work for 45 minutes without a mask on, sitting around a small table every day for 3 days while I was coming down with this sickness. So we would say, okay, we want to talk to those three people. And we would have asked you for their names and their phone numbers. And then the contact tracer would call each of those people. But we want to protect your privacy and your personal information. So the contact tracer has to call those people and say, I'm calling from the health department. You have had close contact with someone with COVID-19 and we're concerned that you may get sick over the next few days. And what's that person's first question going to be?
Who's the person?
I would hang up. I think it's.
Where was it? And we're going to
have. I think it was a scam. I would think it's, it's a scam. I mean,
well, you might think it's a scam. I hope you don't think it's a scam. If we're in person, we can show you our ID tags. But then we have to say, we can't tell you the name of the person because we're protecting that person's confidentiality and privacy. But we can tell you that you've been exposed to this person, and here are the things we would like you to do. And those things are not small. They involve, that person needs to be in quarantine for 14 days after they were last exposed to that person. That means not going out. That means having a separate bedroom and bathroom from other people in the household. If they can't do that in the household, then we can arrange other quarantine facilities for them. So again, it's really those communication skills as well as understanding the script. So part of it is the script and what's the information you're trying to get. And then the art of it is how do you do that?
So I guess my follow-up question to that then, you said, where the basically the person that's the target, meaning the infected one. Specific questions will be asked of that person, and that person gives you specific names that they come in contact with. Now, what if they're in an area that they don't know who was sitting right behind them or who was sitting next to them by name? So, you know, because this is one of the areas, and I've been one of the critics from the start saying, why can't you just release the information where they were? I'm not asking who it is, if it's male or female, because they may say, hey, I was at Rob's on this day. Then I can say, gee, I was eating lunch at Rob's. Maybe I got to monitor myself.
Right.
But it's always been this secrecy where they, you know, and this is coming from not you, but DOH, that they don't want to give that information. And I thought that's kind of odd, because we could you know, like when you have these signs about neighborhood watch, keep an eye out, right? If something like that was to come in our neighborhood, I think a lot more people would be more appreciative and work in conjunction with what you're trying to accomplish.
Right. So we are always having to make judgment calls, right? And make decisions about how much information to release. And you can imagine if you're a business owner and the health department says, oh, people who ate at Rob's, you know, last week might have been exposed to COVID, then suddenly nobody wants to go to Rob's because they think it's there forever. And I've seen that happen with measles outbreaks and mumps outbreaks and hepatitis outbreaks and all that kind of thing. But we do make those announcements sometimes, and mostly we make them in the kind of situation that you described. If there's a place where the person who was sick, in our judgment, exposed a lot of anonymous people or any anonymous people to the disease, and we don't have any other way of notifying them. But if, and COVID-19 seems to be transmitted mostly by respiratory droplets. Most of the clusters and groups of cases that we're seeing happen not just in Hawaii, but nationally and internationally in household groups or in gatherings like funerals and weddings and parties where people are close to each other for a long period of time, and usually inside, but not always. But brief contact, walking past somebody in the grocery store, jogging past them on a trail, that sort of thing, doesn't seem to transmit the disease easily. So if someone went shopping, for example, but didn't stop and have a 10-minute conversation face-to-face from 3 feet away with anybody while they were there, including with the cashier or the employees, then that's not really a high enough risk exposure for us to be concerned. And just to be clear, that's really different from a disease like measles. So measles, we know, stays in the air for an hour or even 2 hours after you leave the room. So if there's been a case of measles and the child with measles we know was in, you know, a grocery store during the time they were contagious, we will put out public messages that say, if you were in this store between this time and this time on this date, you may have been exposed to measles. And if you haven't been vaccinated, you need to let your doctor know. So if this disease were transmitted in that way, then we would be doing that. But in this case, the other thing we do is work with employers. So for example, if somebody had been in a business and they didn't know the name of the employee that they worked with, but they knew when they were there, then we would go to the employer and say, we need to talk to the people who were working during this shift on this day because they may have been exposed. So we try to do it in the least intrusive way that we can, that also gives us the greatest assurance of reaching the high-risk contacts.
Okay, well, that was going to be my follow-up question. So you do inform the business if, in fact, the person contacted one of the employees. So the business, then they can do the proper disinfection and all that stuff. Okay, got it. Earlier, you mentioned about the isolation or quarantine facilities in the events that those, you know, like in the case of the household today in Waipahu, 10 people in a 2-bedroom home. I know one of the reporters asked the question, I think it was Daryl Huff, about when did they all test positive at the same time, or did one come back positive? And then, because it seems if you have one positive, or if you're infectious, I should say, and you are in a household of 14, I believe they said at the press conference, in a 2-bedroom home, chances are you're gonna spread that virus. Were these people allowed, or did they have the opportunity to relocate to another location to maybe prevent 10 people from being, or 9 others from being infected? Do we know?
I'm not familiar with the details of the cases on Oahu, so I really can't speak to that, but I can tell you a little bit about how we've handled situations like that here on Kauai. So when we get a report of a positive case, our case investigators get in touch with them, as I described. And in addition to trying to figure out where they got sick and who they might have exposed, actually the first thing that we're doing is making sure that those people can effectively be in isolation. So some people here on Kauai have been able to say, yeah, I only live with a couple of other people. We have 2 bathrooms. I can have my own bedroom. Somebody can bring me my food. I can really stay in a separate part of the house and be isolated from the rest of my household members, and I'm good here. And we continue to talk to those people twice a day, every day, throughout the course of their illness. And for some people, they've initially felt like they could isolate at home, and then it's become clear that it's really too hard to do that. And if that happens, then we move them to our isolation facility. And some people can't adequately isolate at home. There's not enough room in the house, or there's somebody in the house who has some kind of underlying chronic disease or is very elderly, where they would be at really high risk, and neither we nor the person who's sick want to run the risk of exposing that person to disease. So then we can move them to our isolation facility. It also can depend a little bit on where in the course of the illness we make the diagnosis. So if you've already been sick for 10 days and living at home when you get your positive test, you've already exposed the people in your house to your disease over those 10 days. So, extreme separation at that point, it may in some sense be too late to effectively prevent the transmission of disease to those other people. We still isolate you from them and separate you from them, but sometimes in deciding for the individual who's sick and deciding how to do it, they may be more likely to decide to stay home in that situation. But I don't know the details of the Oahu case, so I don't know how it was handled there.
Okay, I was just curious about the isolation facilities, because where I live, it's just my wife and I, but we only have one bathroom, so it would be very difficult for I mean, I guess we could, but it would mean, completely disinfecting the bathroom every time it was used. So I'd probably move out. I'd probably go stay away for a while.
You're saying she'd kick you out?
Yeah, she probably kicked me out. That's okay. It wouldn't be the first time. Just kidding. No, today at the press conference again, and again, you came on at the right time, I think, because a lot of the material was talked about today. One of the questions was asked Dr. Anderson about the safety of flying inter-island once the quarantine opens up and we are able to go freely between islands, and he was asked if he felt that if we went to another island, if someone flew to Oahu to whatever, go visit family or go shopping, and they went back home and there was no quarantine anymore, did he recommend taking a test or getting a test? And he said he did not, unless you were symptomatic, then he didn't recommend. He fully supported the free travel between islands, and that he didn't recommend or see the need to be tested unless you were symptomatic. And and then I'll go right into the testing part of it, because I think we're having a lot of questions from the viewers about testing. It seems that the state has always been, the position on testing has been that it wasn't as important as the social distancing and the other safety factors or the protection factors of washing your hands and don't touch your face, which I've done all night because I don't know why my face is itchy tonight. Probably because Dr. Berreman is here. I get all guilty when I touch my face.
I'm trying really hard not to touch mine because I know there's another doctor. They always capture that and show it over and over again. So I'm sitting on my hands.
Dr. O'Carroll counts the people whenever he does a Zoom meeting. He actually counts the times that people touch their face.
Oh my
But he was
goodness.
touching his face when he was on our show. But I mean, it appears that the state was always, I don't want to say apprehensive. I don't know what the right word is, but very, and I heard Dr. Anderson mention it, that, you know, he didn't believe testing would do much for us because it's a snapshot in time and all of that stuff. But there's a lot of people that do want to get tested just for their own peace of mind.
Mhm.
There's a lot of people that felt that they may have had the virus early on. It's tough over here, and you know this, Doc. And I know that they relieve some of the requirements, but as I'm reading some of the comments, there's still people that are being denied testing from their doctors. The doctors are not going to order the test. Why is that? And why isn't more emphasis placed on the importance of testing now that we don't have a shortage of testing? And I know throughout the country, as we watch all of the news shows, everybody is singing the same song about testing, tracing. But it seems like in Hawaii, we're not as aggressive in the testing or the need for testing. Maybe you can help us understand that.
Yeah, I don't want to launch into a lecture, but there's a lot wrapped up in what you just asked. So I'm going to step back a minute and say that as a public health physician, the way I think about managing a disease outbreak, and this is a very big disease outbreak, it's a pandemic, is kind of in 4 buckets, and I think of them in order. So the first bucket that I think of is prevention. The thing that I would like to do most is keep people from getting sick, right? You would rather not have lung cancer than have me diagnose it early, right? Be better not to have it at all. So prevention is the very first thing I want to do. And prevention is what we came on really strong with here in Hawaii in the beginning, right? We put in place the quarantine. We started later asking people to wear masks. We did all of the social distancing and wash your hands and clean your environment and don't touch your face. All of those things are prevention to keep people from getting sick. And eventually we hope we'll have a vaccine, and that's really good prevention also. But we know that we can't prevent 100%. So the next thing we want to do, the next bucket, kind of the next best thing, is to detect the disease, to know that it's there early as we can and as much as we can, to get as complete a picture of it as we can. So that's where testing comes in, and the doctors who do the tests reporting to the health department and the laboratories reporting, and also what we call surveillance, where we're just looking in especially high-risk places like long-term care facilities or shelters or correctional facilities for disease, because we know it can spread quickly in those places. And then the next thing we want to do after detecting it is contain it. Build a wall around it, if you will, keep it from getting outside those boundaries. So that's what isolation and quarantine and the contact tracing and all of that are about. And then the last bucket is the healthcare, the treatment, the taking care of people who get sick, having enough ventilators and enough ICU beds and all of that, and medicines eventually. So we need to do all of those things. And so to me, you heard me say that testing is in that second bucket. And so I do think testing is really important, but testing is not prevention, right? Testing is detection. If I test you and you're positive, I have not prevented you from getting sick. So it's not that I don't want to test, but we also need to keep focusing on prevention, because if we aren't doing prevention, no amount of testing in the world is going to keep the disease from spreading, right? The containment will help, the treatment will help, but we'll still have all these people who are sick. So that's a little bit of the disconnect. Testing is an important piece, but it doesn't replace the prevention piece. So does that make sense?
It does, but wouldn't you agree that testing also would prevent potential spread of the disease for those that asymptomatic group? And I think that where initially, I think it was kind of the understanding, or everybody believed that this virus could only be spread by symptomatic people. That's what they thought, early on. And then it became very clear that And the number I've gotten from all the experts here and that's been on our show, it's consistently about 40% of the positive cases were asymptomatic. That's the average. And I mean, we've
Yeah.
seen it in the military ships. It was actually higher, but the average is 40%. So I think for many of us, we believe that many of us may have had the virus, just
Right.
never had the symptoms, went through it,
Right.
and potentially may have infected others or could infect
Right.
others. So
Right.
I agree. I
So,
think I agree.
so,
Prevention always is the ultimate, but
so I said I didn't want to give a lecture, but I'm going to keep going about testing. So yes, I know Dr. Capono said that he prefers the term pre-symptomatic, and I think as we learn more about asymptomatic transmission, we're learning more and more that it's not so much that people are infected with it and never get sick, but that they're contagious before they feel really sick. And you know, if you're coming down with a flu or a cold, you have a couple days when something's not quite right, but you really hope you're going to be able to fight it off, and you keep going about your business, and you wouldn't really say you were sick. But then when you get really sick, you can say, oh yeah, I started feeling a little bit different a couple days ago. So that's that pre-symptomatic phase. And almost all virus diseases that we know of are contagious in that phase. So it's actually not surprising that that's the case. And if you think about it, that's when the virus is more likely to spread, because that's when you're going more about your regular activities. When you start to feel really lousy, you stay home in bed, you aren't out partying. So yes, the thing about, so there are two kinds of testing. One testing, the kind where they stick the swab in your nose that Dr. Capono brought, that's testing for the actual virus, and that tells you whether you're sick right now. So that's like getting a test for strep throat. It tells you whether you have it today. It can't tell you whether you had it 2 months ago, and it can't tell you whether you're going to have it tomorrow. It just tells you whether you have it today. And that's the most common kind of testing that people are getting done. And then the other kind of testing is antibody testing, and that's a blood test. And that tells you whether you've had the disease in the past. It doesn't tell you how long ago, and it doesn't tell you, we don't know what it tells you about whether you're immune. And unfortunately, it doesn't tell us that you don't still have the virus now. But for people who wonder, gosh, I was sick back in January or in February when we weren't doing a lot of this testing, but I had traveled and I really think I probably had it. If you're curious about that, the antibody test, the blood test, is the one that will give you an answer to that. If you think that you were exposed to somebody recently within the last 2 weeks, and that you might, and you're worried that you might have gotten it from them now, then that's the time to get the swab in your nose, or if you're feeling sick. And both of those tests are available very widely. They do require a doctor's order for a lab test, just like you can't get your cholesterol tested without your doctor writing you an order. But there are, for the nose swab specimen, there are 5 different sites on the island where people can go to get those swabs done. And those have been set up through partnerships with KVMH and Samuel Mahelona Hospital and Wilcox Medical Center and various sites. So initially that wasn't the case, but now there are sites open 7 days a week and on all parts of the island. And any doctor's order for a lab can be taken to any of those sites to get the specimen collected. And for the antibody test, the blood test, it's like any other blood test. If you have an order from it for your doctor, you go to whichever laboratory you use and they draw your blood and they send it off. So both of those are available to our Kauai residents. And I know, I have not listened to the shows, but I know that you've had various people on who've been proponents of having big mass testing clinics here. And Kauai hasn't had those. And I think that we haven't had them because we haven't needed them. We've only had 21 cases. And you could ask me, well, if we'd been doing more testing, Dr. Berreman, would we have found more cases? Do we only have 21 because we didn't look hard enough? But we know that you know, it's like an iceberg. Some people are really, really sick with this disease, and more people are less sick. But if we had lots and lots of people on our island sick, if this disease were spreading here and we didn't know it because we weren't testing, some of those people over the last 9 weeks would have been sick enough that they would have come into our emergency room or our hospital. And now we have plenty of testing capacity, and all of our healthcare providers are really thinking, is this COVID-19? So somebody with those symptoms now would for sure be tested. So I feel very confident that we don't have rampant undetected disease in our community. And I wouldn't have said that 6 weeks ago, but I can say that with a great deal of confidence now. Whether that's going to change as we have more inter-island travel, that's an unknown. And can I digress a minute from the testing? Because I wanted to say something else about that. You asked about the inter-island travel. One of the things that I was really struck by today, in addition to us having 15 cases on Oahu today, it's also the case that we have had no cases on a neighbor island. Tomorrow will be 4 weeks since there was any new case on any neighbor island. So that means that all of the neighbor islands will have gone gone 2 incubation periods or longer since they had a case. So the other neighbor islands are all joining this club that used to just be Kauai, where they haven't had a case for a long time. And that means that we don't have evidence that there's ongoing community transmission on any of our neighbor islands. So it's a really interesting situation to have that very low or zero level of disease on the neighbor islands, just as we are poised to open inter-island travel. And what it means is that we're lifting the inter-island quarantine, but we're not just lifting it and saying go, right? We're lifting it and we're putting in place some screening of people who are traveling inter-island. We're putting in place the temperature checking and the symptom screening, and also just getting contact information for those people. So what we will have the opportunity to learn in the next, I would say 4 weeks, but 2 to 4 weeks, is how effective those screening measures are. Do they result in us being able to keep the numbers of cases on the neighbor islands relatively low, or does it result in a bigger increase in the neighbor islands? And if it results in a bigger increase, I mean, we're all going to be watching this very closely. There's a district health officer in each of the counties, and we're looking to see what's going to happen here, because we know right now it's all on Oahu. And if it comes here, we want to detect it, contain it, and keep it from making our residents sick. So that might be a reason to, slow down a little bit on our opening up. So anyway, I think it's important for people to understand that we're at this really interesting juncture in the next few days.
Doctor, you said early on containment, right? You talked about containment, and then you just gave a scenario where, it's a fact that none of the outer islands have any reported cases. So it's just Honolulu, Oahu. A layperson, and I'll come from that angle, a layperson looking and has no understanding, but listening to this conversation can think, well, I guess Oahu has a problem. So now, could Oahu, if they're not able to contain and we allow travel from Oahu to the outer islands, is it possible that we spread that way if the numbers are there?
So absolutely, that is possible. It is possible that Kauai residents traveling to Oahu to visit family or whatever may become infected and bring it back here, and Oahu residents who aren't feeling sick yet or aren't feeling very sick come here and could spread it here. The screening at the airports before you leave is to help us identify people who might be sick and offer them testing. And if they're running a fever, tell them that they can't get on the airplane that day. So that's what we're doing instead of quarantine, but we know it's not as effective as quarantine. And so what I'm saying, we'll have a chance to see how much risk is there of people traveling and bringing it to the neighbor islands. And
are you confident that if something were to happen on a large scale, like I'll use an example, like Arizona, for instance, or Florida, where they're having those large numbers. If something was to happen where we had a large number, not as big as theirs, but maybe 100 or a couple hundred, we're prepared. If it does spread to the islands, that each island is prepared to tackle it, and you have the tracers that can, you know, I mean, it sounds like it'll probably be a undaunting task, but I guess
Right.
over a period of time, you'll kind of corral it. But in
Yeah.
the meantime, you just gonna, that many people are going to get infected, and it could get wider. The
Right.
circle could get wider and wider.
Well, if we had 100 new cases in one day, no, we would not have. I mean, here on Kauai, we wouldn't be able to handle that well. We would do our best. We would have our folks from. The good thing about the contact tracing is it's all done by phone anyway, so we could get some help from there. But I think it's actually really unlikely that we would get 100 cases in one day. I mean, I don't, those 100 people would have to have all been exposed at the same time and all get sick at the same time. What's more likely to happen is we would get a few one day and a few the next day and a few the next day. And that, you know, as I said, we have a lot of people trained as contact tracers now. That I do think we could handle. And I also think, and I know that the governor is very interested in, what's the threshold for slowing down our reopening? I don't know if you heard the news today, this afternoon when I was driving home, I heard that the state of Oregon, the governor has said, I'm stopping all the openings that were scheduled to happen because we're seeing too much increase, too many people in the hospital, too many new cases. This is not good. We're gonna pause it for a week and see how things go and then start again. So I think that's, I mean, that would be the prudent thing to do. And I feel confident that that's what we would do in the state, that if we started seeing signs that the opening of businesses, the allowing of gatherings, and the lightening up on the inter-island quarantine, if we start seeing an increase in cases, then there will be a conversation among the governor, the mayors, and the Department of Health about, whoa, is this a time that we should slow things down or pause? I think that what we will be doing is looking very closely at the patterns of those cases so that it won't be, I think it's less likely to be the case that we will do what we did back in March and say, oh my gosh, we have to close everything down and everybody needs to stay home and essential services only, because we have more experience and we can do more testing. So we'll be able to be a little bit more measured in that. We won't have to do everything all at once. But it'll depend on how bad it is. You know, if it gets really out of control, then we might need to do that again. I hope not, and I don't think we will, but it's possible.
Yeah, I think just the basic hygiene, the practices of better hygiene now. You know, I mean, it's incredible how many times I wash my hands now throughout the day. Where I used it after I used the bathroom, but now it's and the sanitizer, it's the masks. I think the people are conditioned now to just be safe. And we got a lot of knuckleheads out there that are not following the rules. But for the most part, I bet, and I don't know this, Doc, and maybe the numbers of flu will probably drop, if it hasn't already.
Oh,
maybe
the numbers of flu. Yeah, the numbers of flu cases statewide went way down in last flu season. As soon as we started doing all of this social distancing and stuff, it just plummeted. So yeah, we know that these things work. We just usually aren't careful enough about doing it. I do want to say that the United States was slow. The Centers for Disease Control were very slow to say, yes, cloth masks make a difference. And so we didn't adopt those as early in Hawaii as we might have. And it's kind of ironic because we have so many visitors from Asia, and we know that it's so much a normal thing for people to wear masks much of the time in Japan and in other parts of Asia, that in hindsight, that's something that we could and should have done sooner, in my opinion. But as we move forward and as we look at traveling more, both traveling more ourselves and having more visitors here, I think that wearing cloth masks when you're around other people who aren't members of your household, especially in an indoor setting, wearing a mask is the single most important preventive thing that we can all do. Washing hands is probably, keeping your distance of 6 feet, washing your hands, those things are all actually more important than the cleaning of surfaces and the disinfecting of surfaces. Early on, we thought that there was a lot of transmission from touching surfaces and then touching your eyes, nose, and mouth. That doesn't seem to be one of the main ways the disease is spread. It's a respiratory disease. It's from the droplets from your mouth when you talk loudly like I am now, or when you sing, or when you laugh, or when you cough.
Doc, you know, we had a question that just popped up, and I want to
Sure.
ask the question. It says, do you believe in testing asymptomatic contacts of positive individuals?
Yeah, so that's something that we were not doing early on, but that, I mean, we haven't had a case here in Kauai for 9 weeks, but our plan certainly is to strongly consider testing asymptomatic contacts. I'm not going to say we would test everybody because it depends on when you were exposed, how long it's been, how close that exposure was, and what kind of setting it is. So for example, if there were a case in a long-term care facility in a nursing home, we would certainly test the residents and the staff, even if they were asymptomatic, because they're all high risk and it's hard to know who had close contact. There are other situations in which we would, and always we're offering the testing to people, and they have a right to say yes or no.
Okay.
But that's a change from March, when we didn't have so much testing capacity, and we knew we were going to quarantine people for 14 days anyway. So it was sort of, well, let's conserve this test because it's not going to change how we manage people.
Yeah, and I think that was the reasons or the justification for the minimal testing was the testing capacity. But I don't believe we have a capacity. I mean, we do, but it's, I mean, we have a lot of tests available. We do have viewers, and we've, you know, because we talk about testing quite often, and we have viewers that are even on tonight that continue to say that they were not allowed, or not, the doctors refuse to have them take a test. Do they have any options if someone goes to their doctor and their doctor says, no, I'm not signing the paper, you know, regardless of what it is. And I know that again, and I said this earlier, the requirements or the restrictions have been reduced for testing. But what options does a person have? Can they call the Department of Health? Is there somewhere they can get a second opinion without, you know, having to be charged an office visit because, you know, they're not primary care? Or is it basically, sorry, you know, you're just not getting a test?
Well, so I'm sorry to hear that people are who are concerned are not being able to get tested, and I do know that that's the case. And part of it is, you know, early on, the Department of Health was very clear to our healthcare providers, you can only test people if they meet these criteria, and we were really the gatekeepers. We're no longer the gatekeepers. It's the doctors who are the ones who have to do the order. So some situations, and I know Dr. Capono said this too, maybe that people were told no a month ago or 2 months ago. It may be worth asking again, because I have been sending out multiple communications to the healthcare providers about, you know, it really is okay to test people who you know, need or want to be tested. But it's always possible to get a second opinion. And many doctors' offices are, you know, just doing telephone calls in order to approve testing. So, you know, calling a different doctor, calling an urgent care center might work, might be an option if your primary care doctor has said no. Wilcox Hospital has a particular phone number for their, what they call their respiratory clinic, where they are screening people by phone and ordering tests for people for whom it's appropriate. So I would say that, so those options are available to people. The health department, we ourselves don't order tests except in the course of a contact investigation, a case investigation and a contact investigation. We don't have enough testing capacity to just test everybody in the state. And doing a one-time testing of everybody in the state, or even everybody on Kauai, like right now, I told you, I feel really confident with no cases in 9 weeks that we don't have a lot of disease here. So it would seem wasteful of effort and time and money and supplies to test everybody on our island now. There might come a point where we had enough disease here, I hope not, where that would be a useful thing to do. But right now, there really wouldn't be any justification for that.
All right. Let me see if I got everything covered here. I know we're right at the hour. I just want to thank you again.
Already. I told my husband I wanted to be on for like 8 hours so I could just answer everybody's questions because people have so many questions. And I have a list of like 15 things I wanted to talk about. We've only gotten to half of them, but anyway.
Be careful. Well, hey, you wanna continue? We can continue.
No,
I was gonna.
I'm good. I need dinner.
I mean, I'm you were sorry, and I gotta apologize because I did send over a request over, and I sent it through the chief of staff, and apparently you never got the invitation. So I apologize for that. We had wanted you on earlier, but
Okay.
I'm so glad that you were able to make it tonight. And again, I think a lot of people are hung up. It's if you don't get to see the press conference every day, or if you don't, the communication, the information that filters back down here to Kauai is tough. The mayor does his show every day and he talks about the numbers, but other than that, it's very difficult to find information that you want in one place. And I think that's why we do this show and we bring everybody on, just to try to inform and educate the public. I know there was something else, but anyway, Charlie, you wanna?
Well, I think early on, I've been one of those critics that felt that it seems like, because we talked about tourism, allowing the travel market to come back, and I've always said that pretty much Hawaii has been blessed with having everything scrubbed clean. I mean, that's what happens. Everything got scrubbed to the bone.
Right.
It's clean.
Right.
And so, without having any kind of measures in place to give us that fighting chance, because we're not like other states. We don't have the ability to just jump in a car and run away if the thing starts spreading. So I looked at it as, why people would want to come here to run is because we got the lowest numbers. So as far as a marketing ploy, that's something that people will buy into. Hey, let's go to Hawaii, especially with cheap airfares. We come to Hawaii because they're pretty much COVID free. But yet we said, somebody got to be tested before you come here, because you can feel good, you can be asymptomatic, and all we need is just entering the protective bubble and spreading at one time. And that's always been our fear.
Right.
And I think you've addressed, some of those concerns. But like you said, we're not all 100% perfect. But again, my passion is because my brother died from COVID in April in New York, and he and his girlfriend side by side, the symptoms are totally different. His was, he got a fever more than 3 days. She just wasn't feeling good, but she never had a fever. The next day he said goodbye to me and to check up on him every day. And the next day he's already going in the hospital and he never talked again. And 1 week later he's dead. So that's the reason why I kind of like, how do we combat this thing, man?
I think we're all going to be touched by this. I've shared with other people that my stepfather passed away 2 weeks ago from COVID. And, he was 96. He had a good long life, but he was a vibrant 96. And he was the first person in his long-term care facility to become sick, from somebody who worked there and was a good worker and liked to hug all of the residents. And subsequently, 8 or 10 other people have become sick. And, we've been so blessed on Hawaii that we have not had outbreaks in our long-term care facilities. And we have, we do have a big kupuna population, and that's a very high risk for us, and is one of the places that here on Kauai and statewide, the Department of Health is working very closely with those facilities to try to do prevention and to try to do early detection so that we can protect that very vulnerable group of our community members. So yes, this is personal for all of us in addition to our work.
So I guess the magnitude of the question is, do you think, based on the conversations that you have with Dr. Anderson, Dr. Park, the governor, that they will be successful in pre-testing prior to coming into the state? What's your read on it right now?
There are a lot of people working on plans for how we open up to trans-Pacific travelers, both international and from the mainland. And my sense is that it will be done very carefully, very intentionally, and that there's been a shift even in the last couple of weeks to understanding that, yes, we want to open up to tourism, and that there are very real risks to doing that as we see increasing cases elsewhere as people open up. So I do feel confident that it will be done with care and with the strongest preventive measures in place that we can put in place. And certainly testing before arrival is one of the things that many of us are interested in having happen. You know, the devil's always in the details. Who's responsible for making sure that that happens and checking it, and how do we implement that? Because of course people come to Hawaii from airports literally all over the world. So it's not a simple task, but I do see a lot of commitment to doing that, and everyone involved taking this very, very seriously. So I feel confident that the decisions and plans will be good ones.
One last question. Someone just popped this up on my screen, and I guess you said earlier that at the beginning, the Department of Health was calling the shots about testing, but now it's reverted back to the individual physicians, right?
Yes. Yeah.
Okay. Because this person asked, can employers get monthly tests for employees? So that would be based on, I guess, you know, bringing employees back to work. I think that's what the question tries to address.
Right.
Because
so,
we've had that before. Well, we had Eric Gill on last night, and that's one of the things they wanted to do is when you bring hotel workers back, you want to ensure the hotels that, hey, the employees coming back, they're safe, they're COVID-free to be working, you know.
So that's something that an employer could arrange through their employee health program. They would need to have probably an occupational health physician who would come up with a plan for them and order that testing, and then do it through the usual healthcare channels. So it's not something that the health department would pay for example, but it's something that an employer could pay for, or, you know, the individual employee's health insurance or whatever. There's, yeah, that could happen.
All right, thank you.
Sure.
All right. Well, again, Doc, thanks. I gotta, you know, I Sarah Blaine is on the call, and I didn't mean to blame her about not getting you on earlier. I think Sarah has been she's a true gem for us, and getting, you know, I gotta say, Sarah is one of the most responsive persons that I know, and so I in no way intended to say that I'm blaming her, but it was in the beginning when we were moving. She was probably getting a dozen or two emails from me on a regular basis with a lot of questions, and she was very responsive. But anyway, no blame. I'm glad we got to get you on this time. I think the timing was perfect, and you've answered a ton of questions. I will say that I'm hoping that people will be able to get tested when they want to get tested, if they feel like they want to get tested. You know, there's always a surprise to me when, and I believe the doctor's order or the requirement or the doctor's script, the prescription is really for insurance purposes, I would guess. That is how the insurance will pay. I mean, I would guess that's how you know, like anything else, you track it with the prescriptions. But so an employer could test their entire workforce if they were willing to pay for it, and the individual who wants some peace of mind cannot get it. And I think that's where the disparity, and I think for many people, a lot of our viewers anyway, they being able to get tested, even if it's for the antibody or whatever it is, would bring them peace of mind, and that's what they're not able to get. And I think that's where a lot of the frustration is at.
Can I say a couple things about that? So through the employer, it would still have to have a physician's order, and that could be one physician ordering blanket for a whole bunch of employees. And that's not just for insurance purposes. It's also because when somebody has a test, the results of that test actually by the laboratory are reported to the ordering physician. And it's the ordering physician's responsibility to inform the employee or the patient who was tested and interpret the test for the patient and tell them what to do about it. So if you test positive for COVID-19, the healthcare system wants to make sure that when you learn that that's positive, you learn from somebody who also knows how to assess your symptoms and see whether you need to go to the emergency room or into the hospital or get your oxygen level tested or any of those things. So it's not just about the money, it's about the healthcare actually and the well-being of the people being tested. I also want to say that antibody tests are very unlikely. The antibody test is very unlikely to be covered by insurance. So, and the last time I checked, it cost $43, but almost everybody who's getting antibody tested is having to pay for it themselves. That's not true for the other test, but the antibody test, that's the case. And can I just say that one of the reasons we have been so fortunate on Kauai is that we're incredibly lucky and blessed, and we are the best island, and somebody is shining down upon us. But also, we have a really unprecedented level of collaboration among all of the key partners in this, from the mayor's leadership to taking, definitive action early, to all of our healthcare providers, to the nonprofits, to the DOE, to the physician community, the county departments, the other state partners. It's just really the collaboration makes this work both easier and successful. And we can all disagree late into the night in the wee small hours of the morning, and it allows us to reach better decisions and I think do a better job. So I'm extremely grateful for all of the great collaboration that we have on this island, and we should all feel proud and lucky.
Good.
And we are grateful to have you as well here on Kauai and especially
Yes.
here on this show. I will. I know you just had a little closing, but take this time to say whatever you want now. Finish your other 15 pages of stuff that you had. What you have this time to address? Thousands of people are going to see this. What is your final closing thoughts for the people of Hawaii, really? Because we got people from all over the country watching.
Well, one thought is that I really do see my job as the district health officer here on Kauai as being a health and public health resource to the community. And whether that's talking to the Chamber of Commerce or to a group of in-home daycare providers or to healthcare providers or teachers in our schools or small groups of parents or faith-based organizations, if I'm not in communication with people who have questions or concerns, then I'm not doing my job the way I want to be. And all of those are examples of places that I have been in communication about COVID-19 and about other things. So please feel free to reach out to me. I'm happy to be on your show again if you want me on your show again, if people have more questions and we didn't get to things. I can give you my email address. I think you both have it already. Maybe you can share it with viewers, or shall I spell it out?
You can spell it out.
It's Janet, JANET .Berreman, BERREMAN @doh.hawaii.gov. I don't respond right away. You will get an out of office message from me now because I'm in the Emergency Operations Center so much, but my inbox is down to 0 every day before I leave and I respond to emails. So it shouldn't be more than a day. And please, when you're around other people, wear a mask.
Awesome. Thanks again, Doc. I think you've clarified quite a bit in this very short hour and 15 minutes, and we definitely want you back. I don't know what's going to happen in the next couple of weeks once we open up the inner island, and I'm assuming the Trans-Pacific flights will open up in a month or so. We also have the remnants of Memorial Day and graduations, and then as well as the protesting that just occurred. That's thousands and thousands and thousands of people that were exposing each other. Thank God we got a low viral load, so hopefully we're not going to get hit too hard. But as things change, we definitely want you back, and you can be our point of contact, and appreciate your time. Thank you so much.
Always happy to do it. Thank you so much. It's really a pleasure.
And thank you all for joining us tonight. Tomorrow night, we have Angela Keene with the Hawaii Kapu Quarantine Busters. They were responsible for helping the police nab that 21 people on the Big Island who violated quarantine, a cult. Oh my God, I can't wait for tomorrow night. That's going to be interesting. a cult that was on 20 cult members and the operator of the illegal B&B or Airbnb all got arrested. So I cannot wait to get the details. Tomorrow night, 7 o'clock. We'll see you guys all here tomorrow night. As usual, thank you, Doc. Thank you, Charlie.
Can I make one last mention
You can
To
have
a
as
good
much
friend.
time as you want, Charles.
to a good friend, Mr. Michael Cordy on the West Side? He and his lovely wife celebrating their anniversary. I believe he said it was 39 years. So congratulations. So I put it on there. And Doc, my personal thanks to you. I've been one of your critics, but you got me believing. You got me believing. And you know, the good thing about it, bringing you on, having you see what you said, it makes a lot of sense. And that's all we need, because you know, too many times we allow things just to float out there. So like they said, you know, get it straight from the horse's mouth. And boy, you gave us the information tonight. Thank you.
Thank you. That means a lot to me. I appreciate that. Thank
Get
you.
them straight from the doctor's mouth, not the horse's mouth.
That's okay. He called me a horse, but that's okay.
Right there, man. Jesus. We talk professional on this show.
I know that statement made me a horse's ass, so I'm sorry. You know?
Hello, everybody. Good night. We love you guys. We'll see you guys tomorrow night at 7 o'clock. I got to get out of here before Charlie gets us in trouble. Aloha.
Aloha.